Inspection diagnosis concept. For diagnosis methods in Chinese medicine, inspection, inquiring, feeling, listening, and palpation diagnosis respectively. Inspection diagnosis is at the first because it has the significant meaning, according to the custom of the Oriental people, the most important and the most necessary must be put the first. In the Difficult Classic Bian Que said, the person who is called immortal knew the disease by inspection. The person who is called saint knew the disease by listening. The person who is called scholar knew the disease by inquiring. The person who is called skillful man knew the disease by palpation. The practitioner who is called respectively saint, scholar and skillful person is human being, which is called skilled craftsman if a practitioner is called saint, which means he is total different from the above other three practitioners. The inspection diagnosis is put the significant position in Difficult Classic. In the treatise on exogenous febrile disease, Zhang Jing recorded, the top doctor knows the disease by inspection, the middle doctor knows the disease by inquiry, the lower doctor knows the disease by palpation. Such as in the Zhen Juwei, Lin Jaihan said, for diagnoses are the first in TCM, at the inspection in the four diagnoses is very urgency. The inner classic of Yellow Empor recorded, see the exterior signs, the internal organs can be known, the diseases are diagnosed. In TCM treatment, the key of the patient must be treated first. If the key moves healthily, the shape of the patient becomes normal automatically. The skin color of people is changing before the person feels sick. At this moment, the level of disease is very superficial. The person cannot feel any uncomfortable. Even the doctors ask the patient, null and palpation the patient. The disease is still not significant. Only the observation can see the patient has something wrong, and this inspection method is so easy and convenient. The ancient people made the observation diagnosis first in the four diagnoses, which had the far meaningful reason. During the inspection diagnosis, tongue diagnosis is the very important step. The tongue is the external orifice of the heart. The heart is the master of the 5 viscera and 6 bowels. The heart controls the spirit of body. If the heart works normally, the spirit is calm. If the heart does not work well, 5 viscera and 6 bowels cannot function well. If something is wrong with the internal organs, the heart is the first not to work well. There is a proverb, capturing the ringleader first in order to capture all the followers. The heart is the key of the internal organs. Aoshi typhoid fever gold mirror record preface. The ancient people named some medical practitioners immortal, because the practitioners knew diseases by the inspection diagnoses, which are not only including face color, but also including tongue coating, hair, sinew, bone, and teeth, nail, etc. All the above diagnosis methods belong to the inspection diagnosis, and the tongue coating rules. Song Yuan said, it does not matter the external disease or the internal disease, the tongue diagnosis is the most reliable. In the clinical test tongue new method, Ying Yanfeng said, the tongue is the seedling of the heart, and the master of the 5 viscera 6 bowels whose key goes through the heart, and whose orifices are open to the heart. The maps of the viscera bowel are connected to the heart, such as lung, liver, spleen and kidney. The channels meridians of the body and the yin-yang of the hands, feet are all connected to the heart. The diseases of the viscera bowel, and the diseases of the channels are all reflected on the tongue. Differentiate yin-yang accord. To the tongue diagnosis, the yin the yang are both right. Differentiate the deficient the replete according to the tongue. The deficient and the replete are never wrong. Will bring to the tongue diagnosis of viscera bowel to make the herbal formulas. The herbal formulas never or ever failed to treat the diseases. In some difficult situations such as some accident, emergency, the patient has not pulse to be palpation, the patient could not talk, especially for the infant and some woman, the tongue diagnosis is so helpful and imminent. The face is suffering from the wind blowing and the sun tan, sometimes is covered by the facial powder. Most time the face cannot be shown the real color, that the tongue is inside the mouth, it almost is not disturbed by outside factors, the key and blood of the face is under skin, that the tongue has no skin, only wrapped by the half-transparent mucosa, so any micro-internal changes can reflect on the tongue. Compared to inspection the tongue and the face to diagnose the disease, the tongue has the natural advantage to be inspectioned and be diagnosed. Said. Compare the tongue diagnosis with the palpation pulse. The pulse is covered by the skin and muscle. The medical practitioners palpation the pulse with their tips of the fingers in order to get the pulse diagnosis through so many layers of the skin. It seems to explore something through so many layers of the threads. It is not easy to get the real pulse diagnosis, especially the principles of pulse diagnosis is so complicated. Different medical practitioners palpation the same pulse of one patient. The pulse results are always different. The touch sense of the human beings is slower than the sense of sight. For example, person who closed eyes to walk forward with someone as help is still slower. Even this person has the normal senses of listening, feeling and touching. If the person opened his eyes to walk, the outside environment is so clear and his walk goal is achieved smoothly and faster. Comparing with the sense of touch and imagination, seeing is believing. The image of the pulse is hard to keep and understand, even the description words and the pictures about the pulse. As the time goes, it is difficult to compare, that the tongue image can be kept by the way of the photographs. As the time goes, the tongue pictures still can be cool, art and compared with each other.